Governor Glenn Youngkin recently announced that he's applying for $1 billion in federal funding meant to transform rural health systems. On the surface, that sounds like what many of our rural communities need. Strong hospitals are the backbone of stable towns. They're essential for public health, yes, but also for jobs and for local economies. But here's what's important to remember. This new rural health fund only exists because of the Medicaid cuts that Youngkin himself supported. Those cuts took millions away from the very hospitals now fighting to survive. In Virginia, our hospitals are projected to lose tens of billions of dollars over the next decade because of those cuts. So now we have a situation where the harm came first and the quote solution is arriving years later, and it may not be enough to undo the damage. And even if Virginia receives the full amount that Youngkin is requesting, the funding comes with limits. It's meant for long-term system improvements, not the day-to-day operating costs that rural hospitals are currently struggling with. Some are operating in the red right now. Without support for those basic expenses, it's hard to imagine how any of these facilities can even stay open long enough to benefit from any long-term transformation. There are also concerns about how the money will be distributed. Every state gets the same base amount, no matter how big their rural population is, and the rest depends on a scoring system that can be inconsistent. That means that Virginia could still end up with less support than our rural communities need. So while the announcement sounds big and hopeful, and I truly want our rural hospitals to get every resource possible, it's important to look at the full picture. Rural Virginians deserve real, long-term investment, not temporary fixes or political branding.